today we'll be starting with the joints. So there are a few different kinds of joints we should know. The fibrous joints, where the bones are held together by fibrous connective tissue. They don't have the joint cavities, so they're usually in the brain, as you can see, head, pardon me. Cartilaginous joints, where the bones are held together by cartilage. They also don't have the joint cavities. And synovial joints, which are articulating bones capped with cartilage. They have ligaments to stabilize it, and they have the fluid-filled joint cavities. So, breaking down the classification, a simple joint are two articulating surfaces, so shoulder, hip joint. A compound joint are three or more articulating surface. Oh, pardon me. The shoulder, while the elbow is a compound joint because there is the radius and the ulna and the humerus all playing a role in the joint itself. And a complex joints, which are two or more articulating surfaces with an inarticular disc or meniscus, so the knees. In more detail, fibrous joints. They are somewhat rigid, and some of them do allow a little bit of mobility, but the rigid ones are in the skull. There are sutures, and there are three different types. So a serrate suture, if you can see here, line up with each other like a zipper. A lap suture overlaps each other, and a plane suture, you can't really see it here, but as you can see here, it meets each other like on the same plane in the middle. And they're held together by an irregular, dense connective tissue. Syndesmoses are the fibrous tissue holding two bones together. So those are in our forearms and in our shins, between the radius and the ulna, and the tibia and the fibula. So these fibrous tissue allow the bones to participate in the movement of supination and pronation in the arm. The gomphoses are the fibrous joints that occur between the teeth and the supporting bones of the jaw, and it's also known as the dental alveolar joint. And as you can see here, dental alveolar, and it is attached to the periodontal ligament, and that connects the tooth and the dental alveolus of the bone. Cartilaginous joints, they are held together by cartilage, and they allow a limited movement in response to twisting or compression. And there are two different types. There's the symphysis, as you can see here, and the intervertebral disc. And they allow a little bit of movement because the vertebra needs to be able to flex to compensate for movement, and the pubic symphysis needs to be able to expand the pelvic. So when a woman gives birth, the pelvis needs to be able to expand to accommodate the head of the child. Synchondroses have hyaline between the articulating bones, and they're found in the epiphyseal plate right here. And the bones of the base and the side of the cranium, the costochondral articulation, so like right here, right here. And for a second, let me go back. So these allow the stability and the growth of the joints in the head and in the long bones, but in the thorax, it allows the chest to expand. So when you take a deep breath, the rib cage will open a little bit, allowing more inspiration. Synovial joints are freely movable, and they contain a fluid-filled capsule, and the capsule itself is made out of the dense, regular connective tissue. The fluid is synovial fluid. It's secreted by the synovial membrane that lines the inside of the joint capsule, and the articular surfaces are capped with hyaline, so like right here and right here. And if you recall from the previous lecture about cartilage, this particular articular surface does not have perichondrium. So the articular cartilage is nourished by the movement of the synovial fluid. So every time you flex your knee or you stand, it pushes the synovial fluid around and it bathes the entire joint, right? And the ligaments connect the bone to bone and they stabilize the joint. Right, so the different types of synovial joints. There are 6 main categories. We'll go through all of them. The gliding joints, they only allow the side-to-side or back and forth movement with a little bit of rotation. The articulating surfaces are flat, and they are found between the fingers, in the sternoclavicular area, and the joints between the vertebra. Hinge is the most common type of joint. They're monoaxial, so they allow movement in only one plane, and it bends the joints, so your elbow and your knee. Pivot joints rotate around one axis, and one of the articular surfaces is conical, and it fits in the depression of another bone. So like the radial ulnar joints and the atlantoaxial joint. So that's in the skull right here, or skull. Atlantoaxial is between C1 and C2, and it allows the head to rotate. Condyloid joints provide up and down movement and side to side movements. It's when a rounded surface fits into a depression. And they're found in the radiocarpal and the metapophalangeal joints. Pardon me. But if you can see here, it allows your finger to make almost like a circumduction movement. A saddle allows a wide range of motion, and it's where, as you can see here, a concave and a convex surface fitting together, and it's found in your thumb, which gives us quite the evolutionary edge. It's also found in the ear between the malleus and the incus. Ball and socket joint is the multi-axial joint. It provides the greatest range of motion, and it's an articulation of a convex surface with a cup-like cavity. So it's in the glenohumeral joint and the coxal joints. Motions. So the movements at all the joints are produced by the contraction of skeletal muscle, and the bones act as levers. The muscles provide the force, and the joints are the fulcra, or the pivot point. A couple motions, you can flex, extend, abduct, which is to raise the body part or move the body part away from the midline, and adduct, which is bringing the body part back to the midline. I consider like abduction to take away, like you're being abducted, and adduction, you're adding to the movement back to the midline. And rotation is another prime motion. More important motions are supination, pronation. Supination is when you rotate the forearm so the palm is superior or like anterior. It's important for the anatomical position. So like when you lie supine, you lie on your back and your hands are facing upwards. When you are prone, you are face down. So circumduction is like a cone-like motion, as you can see here, and there's some special movement. Inversion, you move the sole of your foot inwards, so invert, and bring it in medially, and you evert by kicking your foot outwards or turning your ankle outwards. Inversion, if you think about it, is like the most common way for you to twist your ankle when you're foot turns inwards and you bear down upon it. Elevation is like raising your shoulder. Depression is the opposite. And the blood supply, articular arteries come from the vessels around the joint. They're located within the joint capsule around here. So it doesn't directly supply or innervate the blood, the joint itself, actually. So it's all in the joint capsule, and they are found in anastomoses. And anastomosi are really just like lots of connections. It forms like a web-like structure. And the veins always follow the arteries, and they all follow Hilton's law. If you recall from the bone lecture, Hilton's law is that whenever a nerve innervates, nerve or vessel, innervates one bone, it also innervates the surrounding tissue up to the epidermis. Most of the nerves are just like the articular nerves. They're specific for whatever joint it's innervating. All right, trauma. Traumas can be a variety. It can be not serious, which are strains. Sprains are a little bit more serious. That's when the ligaments and tendons do tear. These are usually accompanied by synovitis, and that's when you swell up really bad. And generally, you are given like bed rest, or like you're given a sling to rest the joint that's been afflicted, and you're given some like pain medication. More serious is luxation. So if you can see here, this is a complete luxation. So here is the head of the humerus, and here is the glenoid fossa. This should be right here. So this person has dislocated their arm anteriorly, so it has come forward. Here it is, still there, different view. But in order to repair it, there is going to be a certain maneuver where your arm will be raised and then over the head and then moved back, and that will pop this back into the socket. A subluxation is a partial dislocation, so instead of completely out of the fossa, it might be perched. There's a few ways you can repair injuries, and arthroscopy is an invasive exploratory surgery. You really use that to image the joint or get biopsies. Arthroplasty is the repair of the joint, so that is when the bone will be replaced, and it could be partial and it could be total. This is a partial, pardon me, this is a total knee replacement, as you can see here. All of this has been replaced, all of the femur, and here, see how it like the replacement has even like have replaced the disc right here too. So this will be a lot less painful for people with these degenerative diseases. The hyaline cartilage, the articular cartilage, have been worn away completely, revealing the metaphysis. And if you can recall from the bone lecture, the metaphysis is very innervated, is very vascular as well. So these people will present with a good deal of pain and swelling around the joint. And that's it for now. Thank you for your attention, and good luck studying.